Hi?
No, I can hear you. Can't see you. We'll
Okay.
manage.
Well, I'm
Hi,
here.
Jenna.
Hi, Jenna. Come on in.
All right.
Excellent. Glad you could join us.
You?
Jenna, Amber, Suzanne, and Shanna. Jenna.
Hello. Yeah, I came right down 201 too, and I drove right behind.
That's fine. Okay, so get housekeeping out of the way. If your cell phones are on, please put them on silent.
Yes, I wanted to do that.
And bathrooms are just down and take a left right before the stairs. Then they're right there on the right, so you can't miss them. We're joined by Gardner, Turner, and that's it, right? Darcy, are you in Turner?
Yes.
Okay, excellent. All right, so ladies, welcome to Coding Review. If nothing else that you take away from tonight, this is the one thing I want you to remember. Guidelines. It's all about the guidelines. Okay, and we'll be going over that. So I sent out some handouts where you're all able to print them off. And then did you bring your questions for the pre and post that you took? Because we'll get started with that. We'll get started with those questions. Those handouts that I sent you were some extra help in the event that you did the pre and post and you wanted some extra exercises, but you also have extra case activities or case studies in the review book. Okay? So I have to tell you that since I've been teaching, the review book just gets better and better every year. So this review book is really good. I like how it lays it out for you. It gives you that those extra questions to get you thinking about, okay, what's the content in this paragraph? What am I looking for? Because that's really what you need to ask yourself when you're doing these exercises is number one, what are they coming in for? Why are we seeing them? So the encounter, what's the encounter for? Okay. So is everyone signed up for, let's say, April to take the exam?
No.
Okay, if you haven't, all right, if you haven't filled out your exam form yet, do you have it? Did you find it on Evolve?
Yes.
I have it.
Okay, so the exam application is on Evolve. You can access it there. I recommend that you get it in 30 days before the actual exam that you want to sit for. They need 30 days notice, so don't do it on day 30. Check the website, the AAPC website, because they will list how many seats are left. You complete the application and you get it into Amy. And she in turn takes care of signing you up for the AAPC and getting you registered for the exam. Now put 2 dates on there, because if you can't make it to the first one because it gets filled up, then you have a first choice for the next one. Okay, what can you bring into the exam? Only 3 books. Your ICD-10 book, your 2016 CPT book, and your 2016 HCPC books. So you might have this one, you might have a bigger one. You might have this ICD-10 book, or you might have a spiral bound book. And for CPT, 2016. Those are the only 3 books you are allowed to bring in there. You do not bring in loose leaf paper. No cheat notes, no sticky notes. You can tab. The tabs can be in your book. The understanding is that the notes in your book are to be like if you were working. So you don't want excessive notes, okay? It is how would you work? So the highlighting and underline that I've taught you in this course is fine. The bubbling and highlighting that I've taught you is fine, okay? It's what draws your eye to that section. That's what you want, okay? Those keywords, the simple, the complex. Who can tell me some other ones? Age, percentages, adult or infant, less than 5, older than 5, less than 65, older than 65.
I usually underline all the ones like do not code with.
Yep. Do not code with, or code separate, or separate procedure, or 51 exempt. Okay, what else? Excision, incision. Of course, because I want them, they're escaping me, but you get the idea of what I'm going for. Those are the types of things to look for. All right, so most of you by now have done your pre and post. And you really need 107 out of 150 to score 70 on the ICD-10 exam. All right, that gives you a passing 70%. Mm-hmm. Now, as I said, guidelines. It's not about remembering the guidelines. It's about knowing where to find them. So I have one tab here in my ICD-10 book strictly for pain. Because if you have questions around pain, reports around pain, you were mentioning earlier the sequencing. Mm-hmm. This is what you want to know. How are you going to sequence when you have pain? Okay? So just referring back to those guidelines. But the other part to these books, and you'll notice with the ICD-10, in the front of every section, you already have some of the guidelines.
Yeah, I like that.
Okay? So it's knowing where that begins in your ICD-10 book, and then where to find it actually in the front of the book. Because this one page on neoplasms may not cover everything you need. It highlights it, but if you need more detail, know where to find it in the front. Okay? The big ones are on pain, neoplasms, cardiovascular, okay? And the exam is 5 hours and 40 minutes, so you've already experienced the pre and post. You know that you really can't be interrupted because you lose time. They're not going to stop the clock just because you got up to go to the bathroom, okay? You can bring a quiet snack. You can bring some water or something to sip on. And I suggest sip on it, just to keep your throat wet so you don't get too dry. You can bring some lemon drops, something to suck on to keep the moisture.
They say peppermint is pretty good.
Peppermint, yep. Lemon drops. Pencils, number 2 pencils. Ruler, maybe index cards, as long as there's nothing written on them. If you want to keep...
Like a blank note, like a completely blank notebook or something, or do they want index cards
No,
instead?
probably an index card or a ruler. Yeah. Yep. And that one from the AAPC actually is a good size ruler.
Plus in the middle, it magnifies.
Yep.
Magnifies.
So it's a good one to have. When you're taking the exam, and for those of you who are able to join us for the mock exam, then you'll see the simulation, but I'm just trying to give you an idea of what to expect when you sit for the national exam. They'll read some instructions beforehand, and then you'll have your pamphlet with your bubble sheet, because the bubble sheet is how you answer all the questions. Looks like this. It's in the back of your exam review book. And so as you are taking the exam, you have the booklet on one side, you have your index card and your ruler kind of going down through, and then you have another index card over here on the bubble sheet just to kind of keep track of where you're at.
It's not computerized.
It's not computerized, it is paper. Yes. Let's see what else.
Do they give you scrap paper in case you need to write anything down while you're working along, or?
Actually, they might give you scrap paper. There are very few that you might have to work out that way, because if you get burn question,
Right.
give you centimeters times blah, blah, blah. Okay, yes, you can have scrap paper. But you can also write in your booklets. Okay, the booklets, you can write in your booklets, and there's space in your exam booklet to write. What else? They usually will call time probably the last half hour or an hour. Usually the proctors will say, when do you want to be notified? I like to do it at the halfway point, and then the last hour, and then maybe the last half hour, and then 15 minutes. So people are aware. You cannot leave an answer blank. You have to answer every single question. So as you get down to that last few, literally, if you have time, review the question and then the answer. Otherwise, you're going to have to just pick an answer. And you just do it randomly. The worst thing that happens is you get it wrong, right? And then what happens if you get it right and you pass? So also remember, you have a second chance to take it if you don't pass the first time. But I don't expect any of you to not pass the first time.
I already failed.
Okay. So what can you share about that first experience? Would you
I
like?
ran out of time.
Okay. So,
By a lot.
all right. So then what I've taught all of you along this whole time about time management was true.
And I did fine when I was at home doing my test. I had plenty of time.
Okay.
It just, at the test, I just got completely overwhelmed.
Okay.
And the questions
because it
were,
wasn't computerized?
the questions were way different than that mock exam.
Really?
Yeah.
I don't think I'm prepared to take it. I don't have the new books. I don't
And
know
I'm-
anything about 10. I don't think I'm prepared to take it. I
I'm
think I
definitely
just
not.
Okay.
pay the late fee or the cancellation fee and wait.
Well, when are you scheduled?
Saturday.
Okay. So cancel tomorrow.
Okay.
Call and cancel.
Yeah.
They give you 24 hours.
Okay.
Actually, if they're open when you get home, cancel.
Okay.
On.
I'm just not prepared. I haven't
Okay.
been ready and it came up too quick. I was like, oh wow, it's March 5th.
Okay.
I haven't looked at a book in 2 months.
So.
My problem was I ran out of time.
Yeah.
The ones that I answered, I did very well.
Okay.
The last 30 questions, I did not do well.
Okay.
And that's where I pretty much.
Well, see, that's just it. You don't know if you did well or not because they don't give you the breakdown. They just tell you that for this section, you got this many out of this many.
Right.
So what was the last section? Do you remember it? See, that's what you have. That's what you have to remember.
I know I wrote down the ones that I've struggled with are the 9000s and the ICD 9CM questions.
Okay.
On both of my exams, I didn't do well, and I know that was part of the problem on
Okay.
on my actual exam.
All right.
When you
So
were going through the actual exam, was it set up like the way that the pre and post it goes through? You have
the
Yeah,
different
pretty
attention
much.
each
sections.
section, so you're not completely jumping around.
Yeah.
Yeah, pretty much. I mean, I don't think it was quite laid out that same, but yeah,
But
it seems
similar
to be those
route
blocks.
in some
Yeah.
way,
Right.
yeah. Okay.
Yeah.
Because that's kind of helpful. That's handy. I know. Yeah. So.
And that is because then you have an order to how you're going to look things up in your CPT and your ICD
Time
map.
wise too, I think
Yeah.
too. So.
It does.
Yeah.
So I suggest that you try to answer all the blocks, together. There have been instances where students have ticked one off and saying, I'll come back to it. But then that's where if you're running out of time and you've ticked off these ones that you haven't done, then it's like struggling to get back to them. Try to go through and answer the quick and easy ones first. And then also the one thing I will caution you, if you do tick it off saying you're not going to do it and you'll come back to it, be careful that you tick it off on your in your booklet, so you mark where it was in your book so that you're not having to search, because it just makes it easier. But I don't recommend ticking it off and coming back to it. I recommend that you get through the whole section all at once and not have to go back. But I'm glad that you shared that. Thank you very much.
Yeah. I only missed by 2 points. But
Okay. So, but that's the biggest thing is time management and knowing where to find the information. Okay. So you're going from ICD 9 to ICD 10, and so are you. Okay. So I'll be happy.
Right? Yeah. And you took the test.
Yes, I did.
Okay. So would you share how you felt it went for you?
To do the examining.
Yep.
Well, it was a little stressful, but I think for me, I was afraid of missing any questions, so I kind of like hurried through it,
Okay.
and I think that was one of my errors.
Okay. But overall,
But overall, it wasn't that bad. I mean,
okay.
it's the same format as the mock, you know,
Right.
the post. I mean, post exam.
Okay.
So
All right. So then time management for you also.
yes.
Okay. So thank you very much for sharing that.
So I took too much time and you didn't take enough.
Yeah, I was done in a little over 3 hours.
Yeah. The last 30 questions I didn't answer.
I got all the answers. I mean, I answered all the questions.
Wow.
Yeah. So is that helpful for you ladies? Okay.
No, we're
Yes.
scared.
Well, for those of you who are going from ICD 9 to ICD 10, I'm glad that you're here tonight because, yes, you'll learn some tips and tricks, but also that means that we'll work a little extra with you to help you go from ICD 9 to ICD 10. And what that comes down to is going back through your book and answering those questions with ICD 10 codes rather than ICD 9 codes. So,
I've been doing that. I'm on chapter 4 right now.
Oh.
yeah.
Yeah.
And you might actually just want to start with the workbook.
Yeah. I've been doing that too. That's
Oh,
where
yeah,
I found
that
out.
was in there.
Right,
Okay.
right.
Yeah, chapters 3 through 7 are of ICD 10.
Okay. Will the mock exam cover ICD-10? That you're doing at the end of the month?
Yeah, on the 26th of March.
1 second. Yes,
Oh, good.
yes,
Yeah, good for yeah.
yes. So you're welcome to come join
Yeah,
us
I think
if you
I need to put some more time into this.
want. Okay.
That's
So,
why I think I want to take that mock exam before I sign up for my other test.
Same here.
I don't really want to go to the mock exam and realize, well, I really need to focus on these areas.
Right. right.
And then have a test in 2 weeks because the April one's like
That's-
the 11th or something
Yes,
like that. I
I'm not
looked
ready
at
for
it and I
that.
was
I'm
just
not
a
ready.
little bit hesitant to sign up for that.
Okay.
Same here, because I don't think I'm ready for it.
Okay. So then for those going from ICD 9 to ICD 10, make sure you're emailing me on a regular basis so that we can really put a plan in place for you. Whether you're all sitting for the same date or not, I really want to help you move forward and get there.
And how long do we have?
You actually have till the end of the year.
December.
I took mine in November, and they told me until November something of this year, so we have.
Oh,
we
okay.
have
You have a year.
Okay.
So-
Well, I was hoping to do it in May, so that should be
Okay.
fine.
So you have a
That's
year.
what happened to me. So I started the classes in like mid-April-ish, something like that, and then I had a few weeks off here and there. So I took the pre-exam just before Thanksgiving, I think, and I kind of didn't know that I needed to like sign up so far ahead of time. I was hoping to take a test in December,
Yeah.
but I didn't go through and sign up for anything, so there wasn't anything available in December. So I just sort of
Yeah.
dropped off the grid. So I was too close, and now we're into 10. And I was like, wow. So dragging out on my own self, kind of.
Okay.
Got too close to the end of the year, and then it just sort of went haywire after that. So.
Okay. So then just to reiterate for those online, if you're going from ICD 9 to ICD 10 and you've already taken the exam or not, what you will do is you will go back through your Buck book and all of your end of chapter reviews, do those with ICD 10 codes. All of your workbook exercises, do those with ICD 10. Okay? And you can go through every single chapter. That would be my recommendation.
Yeah.
Because the guidelines don't change. From ICD 9 to ICD 10, the guidelines do not change. There's a few changes here and there, and I point those out in the lectures. Okay?
We won't see the lectures.
But-
Unless you tell us which one.
It's in the guidelines.
Okay.
So when you're looking in your ICD 10 book, remember I told you read before, during, and after? So before you even start the chapter, read it. Okay? Front and back. Because these are the major points that you want to be aware of when you're working in this chapter. And that is the same for every chapter in your ICD 10 book. Okay? CPT. I like the fact that CPT, the very beginning, you have your guidelines. Okay?
Yeah, I like
You have the index,
Yes.
you have the contents, you have white space. What do we do with white space?
Right notes.
Make notes, and then your guidelines. Okay?
So we do have to use our 2016 books?
You
for
do.
Those two?
You do.
Okay.
Yeah.
Okay.
Okay. All right. Any questions this far? Okay, let's get started then. So pre and post. Shana, what questions do you have from your pre and post? Okay. Jenna.
I don't really have any questions. I went back through and looked at them all, and I pretty much understood most of what I got wrong.
Okay.
I'm with you. The medicine section to me is just way overwhelming. The 9,000s are awful.
Okay.
I did really good the first time in cardio, and not so good the second time around. So
Okay.
just kind of dumb mistakes.
Are those
A lot of my problems, a lot of my problems are coming from anatomy.
Okay.
I'm just not. I'm not a memorizer. You know,
Okay.
it's been a while since I've taken the medical terminology, so
Okay.
I know what these things are, but anything out of context to me, I have a hard time memorizing. So just so that's just I don't know what to do
Okay.
about that, but so yeah, just kind of a lot of things that were just sort of like, oh yeah, why did I do that?
Okay.
Looking at, or I stopped at this code and I should have gone 3 or 4 down. I go, oh yeah, that one fits better,
So reading thoroughly all the way
Yeah.
through.
So
Okay.
So
For the anatomy portion, for the anatomy portion, are you making notes in your CPT book in front where it gives you the diagrams and stuff?
I don't really know what to do, what to make. I guess I don't know.
Okay. I would have to know exactly what numbers were the anatomy questions
Right,
to be
yeah.
able to help you understand
Well,
why.
like I said, I don't. It's just a lot of information, and I
Okay.
just seem like the questions were like, geez, I don't remember that one. You know?
Okay.
So
Okay.
just weren't sticking in my head, but yeah.
All right.
Other than that, like I said, I think everything wasn't too bad.
Okay. Amber.
Well, I was just gonna say, when I was sitting for the test, someone had mentioned that you have to get a 70% on each section to pass.
I was not aware of that.
Okay. I was just wondering after the fact when I was just looking down through, I was thinking, well, I did pretty good in most sections, but there was one that I didn't do that great on. And so I was thinking about that, like, so if you only get a 60% on one, but you get,
I heard that.
100%
Now that I
on
think of it.
6 of
That's
them.
interesting. Yeah.
That's
You
the
know,
first
that's
I've heard.
70% per section. I can't
Yeah.
remember where I heard that too.
Okay, that's the first
But I
I've
read
heard of
that
it.
somewhere.
So that made me think, well,
I
so
read that
if you
somewhere.
get a 78 overall or an 82 overall, but you got a 60% on one
On a
section,
section,
did you
yeah, really, that
actually
kind of throws me
fail?
off. Yeah.
Okay,
That
I'll,
would be a big
I'll
step.
ask.
Yeah, because I'm failing at, like I said, anatomy. The first time I only got half of them correct in the 9,000s. Second time I pulled off, I only got 6 right, so I did much better. So yeah.
Well, I did
That's
good
what I
in
want.
anatomy.
Basically,
Yeah.
you know.
Okay, I'll ask. I'll find out.
Yeah,
Okay.
Okay.
that would be good to know.
Suzanne,
Yeah.
did you have any questions on the pre and post? Did you come with any?
No, I pretty much know what I need to focus on, so
Okay.
Yeah, I didn't write any down. I just,
I don't even.
like I said, the 9,000 section and the ICD 9CM section.
Okay.
Both times they weren't the same questions.
Right.
See, I got
That I got
both.
wrong, so I don't know. A couple of them I knew why, but I guess on the medicine one, I know one of them was because I didn't put the influenza and the other one together.
Mm-hmm.
Yes, well, that was my problem too. The
I'm like,
vaccines, I have
Amber,
a
you
really
know
hard
that.
time with. Yeah, see, yeah. I got that one wrong in the coding and an ICD and in the medicine section. I was
Okay.
like, wow, I just don't get this vaccine at all.
Okay. All right, we'll talk about those. I'll
Yeah.
see what I can. Okay. Darcy, questions on your pre and post? Did you print off your stuff?
I did, but I don't really have any questions.
You got 100?
No, but I can't think of anything specific to ask you right now.
Okay. So once you reviewed the rationale, it made sense?
Yeah.
How'd you do on time?
I was like 5:20, I think, the first time, and then like 4 something the second. Which
Okay.
I had computer issues the first time around. It was doing an update right after I started it up. So
Okay. Okay. I remember that one. Okay. How about you, Fran?
I didn't really have any, any questions specifically. I mean, if it was wrong, you could see why once you looked. Anything that seemed like it would be noteworthy, I just, wrote down in the CPT book or an ICD-10 to have for later.
Okay.
So, I mean, I guess anything that was weird, once I read through it, it was like, oh, yeah, okay, that's why. But no, I guess not. And time-wise, I finished ahead both. Not, like, far ahead, but, before the time was up.
Okay. All right.
It was
Good.
all right. Yeah.
Good. How about you, Neetha?
I did not get chance to take.
Okay.
From now on, I do means like I had to go every Thursday at least. I spend.
Okay.
And by April 30, I think I'll be prepared.
Okay. Well,
I didn't get chance.
okay. Well, tonight will still be helpful, and it will go up on Evolve so that even afterwards you can go back and review it. But what I'd like to do tonight is kind of pick and choose some questions from the pre and post and just go over them. And then the handouts that I also emailed everybody, kind of go through some of those and just kind of just pick and choose some and get the answers and see how did we come up with those answers. And I'm going to time them because that's how we would do the national exam. And I usually allow between 2 and 2.5 minutes, and I give you that time. So, number one, this is not a competition. Okay, tonight is not a competition. Tonight is about getting you ready for the national exam. So, you need an ICD-10 book, right?
I do.
Okay. You can still use your CPT book. That
Yeah.
will still be
Yeah.
valuable for now.
All this recabbing and renoting.
Yeah, I know.
and
That's why I
rewriting.
was asking about the 2015 because I already have everything I wanted in here.
Yeah, I know.
And on what I think it was Denise sent me, she said that it was only the ICD book that they cared about the year on.
Okay. Then
Yeah,
that.
I think maybe it's like a strong recommendation, maybe, but sort of like
That's
it's your
why, I
own
mean, are there a lot
loss
more,
if you don't,
are there new codes in those other books?
1 second, I'm writing this down so
Yeah, 'cause that's
so
my
I can
question, too,
confirm.
Like, is it really that different that,
Yeah.
so I almost thought it was like, okay, kind of at your own risk. Like, 'cause if you get one wrong, because if you got your own book, well, then that's
Right.
your own, that's your own problem. And then the whole ICD-10 thing just sort of escaped me, so,
Yeah. As far as changes in the HCPCS and the CPT books, we can actually Google CPT changes for 2016.
Oh wow.
So it wouldn't hurt to Google that and see what codes have actually been deleted.
Yeah.
And then maybe go in your CPT book and make a note beside it, deleted.
Well, that's interesting. Okay.
Okay?
Yeah, because I actually, now that you mention that, I actually got a question wrong on my post-exam. Well, no, that shouldn't have mattered though. Because it said in my book that that code was deleted, but then they used it in the test.
Yeah,
I
saw that
know.
too. But yeah.
You-
What the?
You
Yeah.
know why?
Yeah.
Because the test probably was created before.
2014 or something?
Before.
It was usually my 2015,
yeah.
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 And question 142, the answer given does not match the answer that it's supposed to be.
Okay.
I had that one too. Yeah, I got that.
142 on the post.
That one was.
On code, yeah.
Yeah, yeah.
All right.
You had that too?
I did too. Yeah, I went through what I wrote. Yeah.
Yeah, I did go through and look at all the ones that
I did. Yeah.
Okay. And that's what I wanted you to do. Even if you didn't print them off, I wanted you to write down the numbers so we could review the ones you had
Well,
questions
reading
on.
them like they said, it wasn't that I didn't understand what I did. It was just I got it wrong. You know what I mean?
Yeah.
But there was a couple like that one. I was like, well, how was I supposed to get that right?
Yeah. Exactly. Yeah. Yeah.
All right, so 142 in the post, pre and post was code the substance of a DTaP given intramuscularly to a 6-year-old, assign code for the substance only, and the correct answer was
Not a code in the book. Yeah. It's like 97001 or 97003 or something like that. Yeah. I just looked at it this afternoon, so I remember. I was like,
number 142.
You printed them all out.
She did.
Yeah, I didn't know that it was. I didn't print it like the sheet you guys did.
oh, that's all right.
Okay, so we did the opposite. That's
Good
okay.
practice. It's handy. Yeah.
No, I looked at it, it was like 98 pages. I'm like,
Yeah,
I
had a
emailed
paper
her.
like 3 times.
I emailed her. I'm like, do we need to print every question? She's probably like, oh, it's Amber again. Read.
No, it wasn't 97. I don't know what it was.
Oh, okay. Let me just see yours, Shana.
I think I know.
142.
If you don't read the question,
Right.
sometimes it gives you the
substance
big old
only.
paragraph and it says
I got
only
it.
the physician services.
Yeah, yeah.
And that can trip it up.
So that's what you had to pay attention to with number 142 on the pre and post exam, is that it says assign code for the substance only.
Yeah, but they don't match up, right? A, B, C, and D match up to the answer?
Yeah.
Yeah.
Huh.
It was just the substance.
Okay. So I gotta look at
I
this.
don't know.
So if you look at
Well,
907,
I was thinking the same thing. I'm like, I need to look at it in the book and figure out why.
so 90700, diphtheria, tetanus, toxoids, and acellular pertussis vaccine when administered to individuals younger than 7 years. And this child was 6 years old, and it was intramuscular. It was given intramuscularly, and they just tell you underneath in the parenthetical note 90701 has been deleted.
I don't. Oh, that it's been deleted. Okay, that was what I was.
90701 has been deleted,
Yeah.
not the correct answer.
Huh.
I didn't.
Okay. So
I'll have to look at it when I get back home. 'Cause there's something. I thought that they said that that's what the answer was the 90701.
Yeah,
It doesn't
me
even
too.
exist.
Okay, if they did that online, that was incorrect.
Yeah.
But see,
That's okay. Yeah, 'cause that makes sense. But I'm like, that's not what I saw because I didn't print out. I just clicked on the review exam
Yeah, that's
and
what I
looked
did.
at it, and I was
Yeah.
like, that's not. So something had to have been different. We both saw the same
Yeah.
thing. Something had to have been different online. So
And that's what I wrote, and that's what I wrote down. But
yeah.
and sometimes that happens, and I apologize for
yeah,
that.
oh, it's not your fault.
Yeah. They probably could have gotten it
But-
wrong anyway. Who knows?
But 7.1 is an administration code, and they just wanted the substance.
Right. Yeah. Yeah. Yeah, because I did know. I knew it was only supposed to be the one code, but it just didn't seem to patch up, I guess. But anyway, that's 1 out of 150.
Yeah.
I got enough other ones wrong that it really got wrong. But
How does the length of your
I got the last time I took it, I only got 114 right out of 150. The first time I got almost 125 right. Yeah. But
You might actually be thinking of the question before it, which was 90471. And the question before it was a 64-year-old male coming in for flu and pneumonia vaccine, code only the immunization administration and the diagnosis for the vaccines.
yeah, I got that one wrong too.
What were the codes for that one?
90471, 90472, and Z23.
No, it wasn't that one.
Okay, so 142. If you did get it wrong by the computer, I can say that the computer probably made a mistake because the answer actually is 90700, which is for the substance only.
So is there any other tests or computerized tests that are going to be utilizing ICD-10?
You can
Or
go.
all in 9 format.
Nope. You have the 15 book, right?
Yeah.
Yeah. So the 2016 would be utilizing the ICD-10 format.
Yeah, we don't.
So that's why I gave you these extra ones for CPT.
Yes.
I can go on and get some ICD-10 ones. Also,
I
I
remember
like that.
when we were going through some sections, maybe it was the 3 to 7 that you were talking about, that we had to do some ICD-10 by.
it was chapter 2, and you used the gem files.
Yeah.
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 See, and that's what I just did. Yeah. I don't know.
Oh, wasn't that fun?
Yeah, it was.
You're looking at this like little
On
screen.
the little street, yeah.
Well, you have, well, we
It was just so
we have to
weird.
download.
Okay, so let me
Yeah, I have it. Yeah, I know. Go ahead. Yeah.
Let me make a note about what I can do for ICD-9 to ICD-10 to make sure.
Yeah.
I mean, you're going to have to go back. I suggest it anyway that you go back through your buck book and just answer everything with ICD-10 codes. But as far as exam prep, it probably might be to get this book. But let me talk to Amy and let me find out what I can pull together, okay?
Yeah, so I'll definitely buy the 10 book, but I don't know.
Yeah.
And like you said, you got everything all tabbed and written out. And...
Oh, me too.
Yeah.
Yeah, I got my 10 book, but I didn't know. I know I need to.
Yeah, but see, this, it comes pre-tabbed.
Yeah, but I got a different one. This is what they sent me. This is what the office sent me.
That's what they sent me.
So
I wanted that one.
you did? Why?
I like that one better.
So do I.
Really?
Yeah.
Spiral is way better.
Yeah.
All my other books are spiral except this one, and I have to get used to it.
Yeah. Well, as you see, all my.
See?
Yeah.
ICD-10.
You can find them online. You can
And
get it
it's,
from
and
AAPC.
yours, the index in the front or in the back?
For this one,
Yeah.
I haven't opened it. I literally just pulled the plastic off this morning.
In the front. This one's in the back.
Oh.
The index, see index, right in the back.
Okay.
The E codes, the external cause codes are all in the back also. And the neoplasm. So it's like, I gotta get used to this.
Yeah.
Again, that's why sometimes tabbing it a little extra like that makes it easier.
Yes. Can I see one?
This is hers, yeah.
Oh,
Yeah.
oh,
I don't
yeah.
even have one.
Oh,
I'm supposed to sit for my test.
See, I was
today, but I
gonna do
don't
that.
have one.
I was gonna do that to mine too, because I like tabbing myself. See, like, well, this
Yeah,
one I
we'll
did
have it.
guidelines.
Mm.
started.
Yeah, yeah, I started all right, look at this.
I like the CPT too, because they're already kind of came with the tabs, so I didn't feel the tabs out. Did you have the little sheet of printed tabs already?
Oh, okay. See, I like how you tab.
Yeah, I wasn't sure if I was going to, but then I did, then I added a bunch of other ones too, but,
I like that.
yeah. Yeah.
I need to do that, I need to get some more tabs though.
Yeah, I use those for everything.
Okay.
I have them everywhere, that's why. My name's Jenna. Jenna. Thank you.
Okay. Yeah, I like that.
I know.
But
All right, so we're gonna start from the beginning. And just kind of pick some random ones and kind of go through them, okay? Medical terminology, I don't think I really need to cover that. Well, again, it's finding the section in your CPT book and just making a note for yourself.
And that's,
You know,
That's one reason why I printed my test off is because I know that I'm gonna go back and the ones that I'm pretty sure I struggle with, I'm gonna write in my book somewhere.
yeah.
You know
Yeah,
what I
that's
like
I'm
about
wondering
this-
too,
this
and
one,
that's what I-
though?
You know.
This ICD-10, I don't, well, you don't have it, but you must have noticed it, Doreen, is in a lot of the codes, like, let me see, I can't find one just because I want to look, because I want to tell you about, it'll have like, let's say cardiomyopathy.
it gives you an
It gives you
explanation.
a really good
Right.
explanation.
Where's the, what's this in the,
It's in the ICD-10 book.
In
Oh.
this one.
I say,
Yeah.
okay,
And
yeah,
this one doesn't
yeah.
have it?
Well, that's
I
what
don't
I'm
think so.
wondering too about excessive writing. The first time around, I goofed up the Medicare part A, B, C, and D, and I memorized it for the second time around. But when I was looking at the guidelines for taking the test, it was talking about like excessive writing in books, and I was like, well, is that not going to be allowed? So I wasn't really sure
I can't even talk.
what,
Acute
you know,
myocarditis.
or if you take
definition.
like a photocopy of
See, a lot
something
of
and
them
tape
say-
it in the book,
say
but you could write.
definition,
So
right?
say I'm at the beginning
Definition.
of the integumentary system,
Definition.
could I
Right.
write some different,
Yeah.
No,
Yep.
you know, medical terms and
Yep.
stuff like that? Okay,
Yep.
all right, that's.
You
good
just
to know.
don't want to go overboard.
That's, yeah,
You want to pick the ones that you know that you've been struggling with.
okay,
Because let's say you're at work,
right,
okay, and you're going to be using those terms all the time.
right.
Then you can write them in there.
I
But
see.
you don't want to make and turn your dictionary into your CPT
Yeah,
book.
see, that's what I,
Okay.
yeah, see, that's the thing,
Yeah.
yeah.
Okay.
well, see, it
No.
says
Okay,
inflammation
but
of
yeah.
heart muscle.
That's just me, so move on.
Nope, that's fine.
It kind of says it, but it's different.
Right.
Like this one, like I was showing her, acute myocarditis, I can't even talk, carditis has the definition, and it says the definition under there, but it doesn't say definition.
Right. And you will find that in the ICD-10 book. It does give you more definitions for some of the stuff. All right, so pre and post exam, number 10, which of the following is an endocrine gland? Is it the spleen, the bone marrow, the tonsils, or the adrenal?
Adrenal, I got it wrong.
It is adrenal, yes. So, nature's pacemaker. Is it the atrioventricular node, the bundle of His, the septum, or the sinoatrial node?
Sinoatrial.
Sinoatrial node, yes. All right, so because everyone struggled with ICD, let's see what we've got here. Because if you struggled with it in 9, you probably will struggle with it in 10.
Lovely new class in charge.
You know, remember, it's because it's through a different company also.
Yeah.
This is from the PMIC. This is Elsevier. That's, yeah, Elsevier, yeah. So that's what my other ones are. Are you still
Okay.
through the class?
So ICD-10. I'm going to get my stopwatch because remember I said we're going to time people, okay? I'll read it. So you can make notes, okay? You can take notes as to what I read because you don't have it in front of you. But let me find my stopwatch. Okay, so the question is, a 51-year-old male patient had surgery to remove 2 separate carbuncles of the left axilla. Pathology report indicated staphylococcal infection. So, a 51-year-old patient had surgery to remove 2 separate carbuncles of the left axilla. Pathology report indicated staphylococcal infection. I'm going to write the 4 answers on the board. I don't want you to start looking yet. Hold on.
Okay, 2 separate carbuncles, and what was it?
Left axilla,
Left.
diagnosis, staphylococcal infection.
Left axilla. Diagnosis was staph.
Staphylococcal infection. I think staphylococcal.
Vessels?
Yep. Staphylococcal.
STA. Staph. Infection.
That marker's a little bit hard to see, Doreen, just FYI.
Thank
It's
you.
really, really light. Yep.
Is it blurry on your side too, Fran?
Yeah, it's kind of weird and yeah.
It looks kind of blurry.
Yeah, it's blurry here kind of, and that marker is like not even there.
Much better.
That's better. Thought I was losing my mind here.
I've already lost mine.
Ooh, there we go. Thank you.
Don't look up the answers yet.
This is the
No,
first
I'm
time.
just writing them down.
Yeah, this is the first time I've seen this book, so I'm just sort of looking through the book.
Nope, that's fine. Okay. Bear with me here, getting my bearings. "51-year-old male patient had so we're not going to time this one. We're going to go through this one together first. Surgery to remove 2 carbuncles of the left axilla. Pathology report indicated staphylococcal infection." So, what we want to code for here is the fact that he had what? 2 separate carbuncles removed, right? Of what?
Of
The left axilla. Okay? And then, when we do that, we're probably going to get a note in the guidelines or in the text there in the ICD-10 book that says, code also the type of infection, right?
Right.
Okay? So, when you see doubles in your answers, okay, I would go look up that one first. And the reason being because you're going to kill 2 birds with 1 stone.
I might not be thinking about it.
Okay? Same thing when you have duplicates in the second half. Look that one up first. This is also where you want extra pens, highlighters, index cards, something to go back and forth between the pages because you're going to run out of fingers trying to hold all the pages.
I have bookmarks.
Okay? So whatever is going to be easy for you when you're taking the exam. I personally took a bunch of pencils with me. I had a few index cards, but it's much easier to stick a pen in the coding section and then go back and flip through it, okay? All right, so Jenna, look up L02432 for me. And Amber, look up L02431. And Shanna, why don't you look up B95 B95.8 for me. And Suzanne, look up B95.4. Fran, look up the LO2.93 and the B95.0. And Darcy, look up the B95.7 for me. And when you have it, just put your finger there. All right, you have it, Jenna?
I do.
All right, so Jenna, what's LO2432?
Carbuncle of left axilla.
Okay. Amber, what's LO2431?
Carbuncle of right axilla.
Okay. So the first thing I would do is, because I have duplicates, I would look that one up first. This is going to be, the LO2431 is going to be in the same area. Why am I going to go to this one and not do them at the same time? You're better off just doing it at the same time. Okay? So Amber said it was carbuncle of the right axilla.
Yeah.
Guess what? I just got rid of one.
Yep.
Right quick. Okay? So we know LO2432 is going to be our answer. All right? Fran, tell me what LO2.93 is.
It was carbuncle, but it was unspecified, so that's not going to work either.
Okay? Good. All right. Who looked up B95.7 for me?
It is other staphylococcus as a cause of disease classified elsewhere.
Okay. Keyword classified elsewhere. What is B95.8? Who looked that up for me? Shut up.
Unspecified staphylococcus as the cause of disease classified elsewhere.
Okay. So, is it this one or this one? B95.7. Read that again, please, Darcy.
Other staphylococcus as a cause of disease classified elsewhere.
Right. And Shauna, read it again. Unspecified in.
Staphylococcus as the cause of classified elsewhere. They're the same except for those two words.
And the first word, two words are what?
Other or unspecified.
Okay. Okay. So, Fran, you want to turn that mute?
Mine is on mute.
Oh, that must be you, Darcy.
Mute. God, you guys are chopping cars over there.
Sorry. Thank you. Okay. So can I see that just? Other staphylococcus as the cause of diseases classified elsewhere. Unspecified staphylococcus as the cause of disease. Okay. So other and unspecified. Okay. So the question was, pathology report indicated staphylococcal infection. So it's not it's not other, because we know that it's staphylococcal infection. It's going to be unspecified. And the reason being, because it is the cause of infection. How do I want to say
It's
this?
like it's not broken down further. Is that what
Right.
you're trying to say?
Right.
Okay. Yeah.
Then
I
what's
have a hard
other
time with
one?
that one. Right.
Right. Because the B95, let me just take it for a second.
Okay.
Sorry. All right, the B95 is Streptococcus, Staphylococcus, and Enterococcus as the cause of the disease classified elsewhere. Okay, so think about that. As the cause of the disease. All right, Page 159, Jenna.
Oh, gotcha.
Okay, so these are supplementary or additional codes that we're using to identify the infection agent. In this case, it is the staphylococcal infection. So when we go over to the B957 and the B95.8, the patient had 2 carbuncles removed, so unspecified staphylococcus as the cause of disease classified elsewhere. Oh, because these codes are used as a supplemental diagnosis. So, okay, the gentleman had 2 carbuncles removed, and when they removed them and they tested them, it was staphylococcus. It was unspecified, not other. They didn't specify the type of staphylococcus. Now, how are we supposed to know that? But reading this, we don't. So for this instance, I would say your best bet is going to be the unspecified, which is the very first one here, rather than other. Because we know that the pathology report indicated there was a staphylococcal infection. What type, we don't know. So in this instance, it's an unspecified staphylococcal infection, not an other staphylococcal infection.
Sorry, go ahead.
I was just gonna say, so if it's not listed through B95.0 to B95.62,
Mm-hmm.
but it is listed, it would be the 9.95.7.
Well, pay attention to what type of staph it is, because if you look at 9.5.0, that is streptococcus.
Right.
And 9.5.2 is enterococcus.
Okay, so if it was
And 9.5.5 is streptococcus.
Yeah.
9.5.6 is staphylococcus.
right.
So you have to pay attention to that type of wording.
So if it was one of those, if it wasn't one of those 3, you would have done the other, and it was listed.
If it was listed, we would have the type of bacteria. We would go find the type of bacteria.
So I still don't know.
Yeah,
when
so
you use
I'm
other.
confused.
That's what I'm wondering too. What would be an instance that you would use other?
Other.
Because they're so
Other
similar. It's like,
specified. Other
Yeah.
specified.
I don't know.
Hmm.
Because I'm looking and it's the same instances with the strep when you went back to. So so if you're looking up any kind of diseases, that's what I want to know.
When they list a type of infection that we cannot find anywhere else in the index,
Okay.
So like a last resort.
Then it would be other.
like a last resort. Other would be
So if there wasn't listing, if that question had something there that didn't pertain to
Like a
6.1 or
9.
6.2, then you would use 7. And
yes,
because it's completely not listed, it's unspecified.
right.
Okay, that's okay.
That's what I need.
Other is in the event that
It's there, but it's not in the book.
right, it's there and it's not in the book.
Okay, okay. I think I can wrap my brain around
Okay. See, if they gave us, if they took out pathology report, if they took out that line, then we wouldn't know what type of infection. So we could possibly put other. Because if they're having a carbuncle removed, okay, what's a carbuncle?
It's a boil.
Right. Wouldn't that have some kind of an infection?
Yep.
Yeah. Okay. So, in this instance, if they didn't indicate a pathology report or pathology report inconclusive or just took it out completely and the doctor puts something else along the lines of possible infection or possible staph infection than other. But where pathology report states that it indicates staphylococcal infection, we don't know what type of staphylococcal infection. So it's unspecified. Does that help? Okay. So then let's go back through, how did we get to our answer? Because this is really the tip and trick part of it. And I say tricks, but there's really no tricks. It's just really knowing to find where the information, reading all the way.
Yeah.
Okay? Like so many of us don't do sometimes. I am still as guilty of it, you know, even after 20 years. Okay? So don't worry about it. But so the duplication. And then because we had something else already in the same area, we want to look them up together. Okay? We knew right off that this was not the answer because it said right. So what am I going to do? I'm going to put a line right through it. So I take it right off of my list. And you can do that in your exam book. Okay?
Yeah, there's lots of room to write in there.
Exactly.
Yeah, because I had my notebook beside me. I was scribbling, you know, when you're on the computer.
So then, if I know that this is already left axilla, I'm going to get rid of this one. I'm going to look it up real quick just to see if it's anything, but then I'm going to get rid of it. Okay, so we just got rid of 2 real quick, and that's what you want to do. In that 2 to 2.5 minutes, you want to get rid of the 2 incorrect answers as quickly as possible. Okay? So then you move on to the next code if there is one. And because these were both left, obviously we had to choose between other and unspecified. Other and unspecified. So then just read your exercise and determine, okay, which one is it? So, no. Okay, but does that help? How to attack?
Yeah.
Yes.
How to attack them?
Yeah. Because if those 2 had been wrong, then you still would have eliminated 2 immediately.
Right.
You know? So.
Now you could also have done it backwards. You could also have started here. So if you have duplicates here, you can also do the same thing. Look at those. See which one. Okay? All right, let's try one more before I start timing you. Because this is the ICD section, so. All right, this one. A patient is diagnosed with acute bacterial endocarditis due to AIDS.
Acute bacterial carditis.
Patient is diagnosed with acute bacterial endocarditis due to AIDS. Because this one is going to be where sequencing comes in.
My specialty.
Yeah, me too.
You ladies online see these okay?
Yes. Thank you.
You're welcome. Okay. So, the patient is diagnosed with acute bacterial endocarditis due to AIDS. So when we're coding for AIDS, what do we do? What does your AIDS guideline say?
Oh,
This is where your guidelines come in. So you would find your sequencing for, now this should be right in the first of the section for your B, okay? Because look, we have duplicates here, B20 and B20 over here. Then we have I33.0 and I33.9. So if you remember, off the top of your head, that your AIDS code is sequenced first because they have AIDS.
I knew that one.
Okay? You know that you can get rid of these two right off the bat.
Mm-hmm.
But if you didn't know that, where are you going to look? In your guidelines. Okay?
Yeah, would that be under HIV?
AIDS, HIV, but if you look at the section in your ICD-10 book that starts with the B's, where is it? What page is it?
Oh, with the bees?
131.
Okay, so if you look at 131, you have guidelines right there at the front of the, you don't have yours. Okay, so yours is going to be a little off. Sorry.
Yeah, that's fine.
Right?
Yeah, okay.
Right here.
Oh, okay.
Okay, certain infectious diseases. Here's like a little tickler for you about where to find your guidelines.
Okay.
Okay, so then you would know that you would go to section 1C, 1A. And find it in here.
Okay.
Shauna, did you bring the other ICD-10 book?
I did know.
Okay. Where do you live?
Awesome.
Where do you?
Brunswick.
So you two might want to get together. Okay, share the book.
Okay.
She's going to share some stuff with you. So make sure you exchange emails or phone numbers tonight. Okay? If you don't mind.
Yep.
And then it might help both of you as far
I
as,
like that one. I like
exam
the coloring
prep.
better.
I
Because it's a
do.
lot more similar.
how's that?
I do too.
Yeah,
To the
fine.
nine.
Okay.
She doesn't mind.
But before you leave tonight, I'll go over a few things with you.
Yeah.
Yeah.
Okay, so we know from our guidelines, we're going to start with B20 because they have AIDS. Okay, so then all you have to do is look up I33.9 and I33.0. Go ahead, do it.
I-33, what, 9 and 0?
Here, I got it.
Then what?
Just wait.
Okay.
Sorry, Doreen.
No, you're fine. And we said acute? Did we say acute?
Yeah.
Okay. Okay. Shauna, what did you say?
I didn't finish reading it.
Oh, sorry. Jenna.
I would go with 0 because it says acute and subacute, and then underneath it says bacterial endocarditis, also acute, subacute.
Amber.
I said 0.
Suzanne.
0.
Fran.
Yep, I got I-33.0.
Yeah.
Anita,
Yeah, 33.0.
Darcy,
I 33.0.
Shanna.
I'm waiting for you to say why.
Why would you pick 9? Here's I-33 9.
Mm-hmm.
Okay. Acute. There's no acute endocarditis here. Only subacute.
Oh, okay.
And this also says acute and subacute unspecified, whereas this says endocarditis acute and subacute. So endocarditis is first. This one's unspecified,
That's because I'm reading up here.
and this one is infectious.
Mm-hmm.
This one's unspecified.
Okay.
Got it?
Yep.
So it is B20 I-33-0. Okay?
Hey,
And
Doreen.
it's- Yes, Fran.
Sorry, something that you had said way back at the beginning of class, and with things like this, as far as sequencing, it seems to be helpful. It was to me anyway. Something like if you had a condition that was due to something else that was underlying, whatever it's due to is the thing you should be looking at first. You know, and that seemed that helps with stuff like this. It seems like, so thank you for that.
You're welcome. Good. Glad it helps. Okay, so let's try another one. Okay. Because as we said, time management is the most important piece here, but it's also knowing where to find your guidelines. So for Amber, you saw that when you looked up that code, it had a little blip in your book that gave you the guidelines. So you knew that you could go to section 1C, 1A2 or something like that. For you, Suzanne, in that gray ICD-10 book, it also gives you a little blip, doesn't it?
Yes.
Of where you can go for the code.
No.
Okay.
Oh, wait, well, yeah, just down here, it just says use additional code to identify infectious agent.
Okay, no,
That's
I'm
it.
talking about the guideline, where to
Oh,
find the guideline.
guidelines, wow.
So in the front of your book, in the front of
Oh,
the,
yeah, well, over here it says code first underlying disease.
right, but in the front of the section here, we know
Oh, yeah.
for chapter
Yeah,
9, on page 347, if we go,
I think it's, let's see.
okay, right here,
Oh, okay, yes.
okay, documented as non-transmural or subendocardial but by site, we can go to section 1C, 1A, okay? So it's just knowing where to find those guidelines, okay? So the next one. A patient with spinal stenosis at the C5, C7 level with a painful intervertebral disc displacement had a cervical discectomy, corpectomy, an allograft from C5 to C7, and placement of instrument, a 34 millimeter plate from C5 to C7.
Whoa, yeah, could you repeat that, please?
I'll repeat it.
What are you looking for?
I'll repeat it. Okay. Let me put the answers on.
Then we coding the diagnosis, we coding the procedure.
What is that?
No procedures yet. if we go by what I said here as far as duplicates, right? First of all, let me read the question again. A patient with spinal stenosis at the C5, C7 level, painful intervertebral disc displacement, had a cervical discectomy, corpectomy, and allograft from C5 to C7, and placement of instrument from C5 to C7. All right, so we have the 4802, the 5023, the 54.20. We have 50.23 duplicate, 4802 triple. What do you think is one of the very first ones we can get rid of?
4802.
No,
No?
this one. Yes, it has 4802 in it, but why can we get rid of this one?
Oh,
What's an S?
I forgot.
Look it up.
S13.
S13.171.
71.
Other external causes.
Dislocation.
External cause.
It's dislocation of C6, C7 cervical vertebrae.
It's a dislocation of cervical vertebrae, C6, C7. Is that what you said?
Yes.
Okay. Don't ask me how I knew that. I didn't know it. I just knew that that S code was out of place.
Okay.
I knew that it wasn't appropriate for this exercise. Because S is for what? What is the S section?
Injury, poisoning, and certain other
Injury,
consequences.
poisoning, and certain other causes.
Thank you, Jenna.
Okay? So if you look at the heading for S13, what is it?
You want me up here?
No,
Oh,
S13.
okay.
Dislocation and sprain of joints and
Okay? Was this a dislocation? No. So, Fran, if you know these sections, doesn't mean you memorize them, but if you do them enough, you're going to know it's out of place. It does not belong. So you got rid of that one real quick. Another way to get rid of something is if it looks off, look it up. Okay? Look it up first. Okay? So then that leaves us M4802, M54.2, and M50.23. All right? Shauna, look up M50.23. Suzanne, look up M48.02. Fran, look up M54.2. And Amber, look up M50.30. And Jenna, will you look up M54.2? All right. Who had to look up M50.23? All right, Shauna, what is it?
Other cervical disc displacement, cervicothoracic region.
Okay. Other cervical thoracic displacement. I'm going to just kind of simplify it, okay? All right. Who looked up M48.02? Suzanne?
Spinal stenosis, cervical region.
Spinal stenosis, cervical region. All right, who looked up M5 4.2?
That was me, and it was cervicalgia.
Okay. So right off, we can get rid of 5.4.2 because it's cervicalgia, right?
Yep.
50.23 was the cervical.
I have the before.
50.23 was what again?
Cervicothoracic disc displacement.
Okay. Cervicothoracic disc displacement. This is not cervicothoracic because it's not C7 to T1. All right? It is C5 to C7, which is strictly cervical. So guess what? We just answered it by eliminating the others. Okay? Now, M4 8.02 is the correct answer because it was the spinal stenosis. The M5 0.23 is correct because it does describe the displacement. It is not the primary diagnosis though. The M4 8.02 is because the patient has spinal stenosis with the displacement. Okay? Does that make sense?
Yes.
All right. Helpful?
Yeah, but I don't understand why they didn't.
Yes.
Amber?
I just don't understand why they didn't use a different code.
Like what?
Well, M50.22 mid-cervical region. So we're on page.
Because this is clearly spinal stenosis of the cervical region.
Mm-hmm.
This is other cervical displacement. This does not in here anywhere indicate that it's spinal stenosis and disc displacement.
Mm-hmm. But neither did this one.
This is a secondary diagnosis.
Yeah, I'm just
though.
wondering why they didn't use like this one for that secondary. Like when we're doing it, why wouldn't we have used that? Is all I'm wondering.
Let me read the question again.
I mean, it does say C5 to C7 level.
Right. Probably because, good question. Because the cervical spine clearly is C1 to C7, where the thoracic spine begins at C7, T1. But they didn't place the instrumentation past C7. So, I mean, it could be either or. I wouldn't go with, what was that one number?
I was saying the 2-2 versus the 2-3.
Right. Right. If you had to code it in the real world, you possibly could get away with the 2-2, but on your exam, just go with the closest one, which would be your 2-3, because then that's where you're going to get stuck.
Oh yeah, I'm gonna get stuck. Don't worry about that.
No, you're not. Okay.
Okay.
Fran, were you going to say something?
No. Just listening.
Okay. You bring up a good point. In the real world, I would say that it could possibly work. But because it's the only one they give you on your exam, try not to second guess it and just get it done.
Okay.
Okay. Because that's what catches us, is that we sit there and we think about it too much.
Yeah, that's exactly what happened to me. So I don't know. 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 I don't
And in the real world, when you have to sit there and think that long, I literally get up and walk away. It's like, okay, I gotta come back to this one. I take and I just set it aside and I find something else to do until I can come back and really look at it and then figure it out. Or you ask a coworker or someone. Okay? All right, so this one is a patient is diagnosed with bilateral otitis media. Okay, so this one is a little trickier. And you're probably saying, why is it trickier? Because when you're looking it up, you want to do it in the most efficient manner. You don't want to be jumping back and forth. So you start with H6640, then H6693, then H67.9 and H68.139. Go ahead.
Okay.
You can do the index.
Yeah, because when I was going through, I felt like if I had to use the answers to get the answer, that I wasn't smart enough or doing it right. So I always tried to look it up first, but I get where this can be very useful as well. Yeah. Okay. I'll try my long way.
No, it's not a long way. Because in these particular instances, you can either do it like I just said, or go straight to otitis media and look up bilateral. It's not right or wrong either way. But if you want to do it for efficiency and you're looking at numbers, do it in order because you're going to put your pens and pencils in the spot.
You said to the left.
Yep. Yep, down left. It's right there.
Okay.
I could see.
Shanna, what do you have?
66.93.
Jenna,
Yeah, that's what I came to.
Suzanne,
That's what I came up
Fran.
Still looking. Hold on.
Okay. Darcy,
H66.93.
Anita,
Yep.
H66.93.
okay, that's it. So how many did it by looking it up in the alphabetic index? Okay, perfect. As I said, there is no right or wrong way.
Just because it's so straightforward, I mean,
Yep.
I figured that's like the easiest way to use the index. Like, wow.
All right. All right, let's go to a patient presents for an influenza vaccination and pneumococcal vaccination. Each vaccine was in a separate vial and was administered individually. Report the ICD-10 code. So the question is, a patient presents for an influenza vaccine and pneumococcal vaccine. Each vaccine was in a separate vial and was administered individually. I'm going to just let you guys look this one up. And then when we start the next one, I'll time you. So the question is, a patient presents for an influenza vaccination and pneumococcal vaccination. Each vaccine was in a separate vial and when it was administered individually. So this is where your guidelines come in. What did you have, Shanna?
Nothing.
Jenna?
This is the first time with the ICD-10 and I'm confused on this one. It seems
Okay.
less specific than the 9, so.
Okay.
I did remember I got this one wrong though. And it said
Okay.
even if they're administered in 2 different vials, if they're done at the same encounter, then you use a combination code. But that's, I don't know what's going on.
Suzanne?
No, I don't have anything yet.
Fran?
I had Z23.
Darcy?
I had Z23 as well.
Anita?
What'd you get, Anita? She's still looking.
Okay.
I did look that up, but Z23.
I have Z23 too.
Okay. The answer is Z23. Because, bless you. Because it reports the reason for the encounter. Okay? The administration of the vaccine now would be coded separately. So the administration code is like a 95115 or 95117. All they're asking for here is a diagnosis code. And Z23 would be the encounter code. So if you look in your ICD-10 book, where's your Z's? Right here. Okay.
33 page.
Just seems very unspecific. It seems very unspecific.
Yeah, but it's
You know.
all of that's all it says is encounter
Yeah.
immunization, but then
Right.
it says code for any routine childhood examination and procedure codes are required to identify the types of immunizations given.
It's still warm. I can't believe it.
Oh, good.
Say again?
It's still warm.
Oh.
I can't believe it.
Okay. I was looking for in your guidelines right here. Administrative exams. Non-specific. Okay. So basically, the Z codes are for those instances where we encounter the healthcare.
The Z code indicates a screening exam is planned.
Yes. And for this, it was a matter of going in for, I can't see.
Routine and,
Encounter for immunization, code first any routine childhood exam. Procedure codes are required to identify the types of immunization given. So basically, they were there for a vaccination, and all we're coding is that encounter for that vaccination. What page?
1018, for the guidelines on Z.
And what's it say?
Vaccinations.
Okay.
Code Z23 is for encounters for inoculations and vaccinations. It indicates that a patient is being seen to receive a prophylactic inoculation against a disease. Procedure codes are required to identify the actual administration of the injection and the type of immunization given.
Okay, so that's what you want to highlight.
Then the last one, it says code Z23 may be used as a secondary code if the inoculation is given as a routine part of preventive health care, such as a well baby visit.
Okay, so page what, Suzanne?
1018.
1018, number what?
2.
Page 1018, number 2, highlight or star it.
C2.
C2.
Can you read that question again now?
Yep. The question states, patient presents for influenza vaccination and pneumococcal vaccination. Each vaccine was in a separate vial and was administered individually. So it doesn't matter that they were administered individually. The fact is that they came in to have just a vaccination. So what lost you, Shauna?
Because it doesn't say. Yeah.
Yeah.
So I would be looking for the whole thing.
Right, but
Yeah.
But
I did think the
we
same
only
thing.
gave you these codes,
Right.
so that's all you're going to code.
Yeah, sometimes that does confuse me when they kind of just leave it open and you just see this, one or two codes, but you're thinking the
You
whole
gotta do
thing.
the whole thing.
Yeah.
Because it doesn't say just the.
Right. All right. What if we move into the 9000s? You feel a little better with the ICD-10 codes?
Yes.
Well, I think so.
Yeah. I hate that.
Jenna?
Yeah, I think so. Yeah.
Okay.
Well, we solved that.
Fran, do you have fun at class?
Yeah.
Yeah, we do. you wouldn't know we were here, but yes.
Well, that's good.
Yeah. We have popcorn over here, so we're living it up.
She's always got pop.
Yeah, they always have food on their end.
Chomping away over here.
Wow.
How about E&M codes? Everyone was okay with E&M codes?
Yeah.
Yeah, I did good on those.
Yeah.
8 out of 10, 10 out of 10.
All right. How did everyone do with anesthesia?
Good. First time around.
Yeah, that's what I did the second time around too.
Okay, pay attention to the qualifying circumstances, the modifiers, you know, the P1, P2, P3.
One of the ones that had the modifiers from the
Anesthesia.
HICPIC book.
Okay,
I got
did
that one
play on
wrong.
that.
So,
Anesthesia.
I
Yes, I
didn't
just
do well on
didn't-
them, but it's because I remembered from before.
Right.
It wasn't what I read in the book that helped.
What's
yeah, it was the HICPIC. Those
Through
those
school.
throw me off because I don't understand that book.
What's
So.
the 3,000?
And I don't understand why they need to be used. It didn't
Cardio?
the question I got wrong.
Cardio.
didn't-
That, I need that.
I really struggled in class that week
For what?
for cardio.
Cardio, I did
Yeah,
too.
But
I
didn't-
know. Well,
I
I
did
didn't
well.
do that great.
Oh, I did 10 out of 10 and 8 out of 10. So.
Well, I didn't do that great. You know, I did better on the pre than I did on the post.
I did too. Because it was 3 months in between that I took
Oh,
mine
my.
too. So.
Well, I did them like, let's see, well, about a couple weeks
Yeah.
apart.
Really? I did mine the end of November and then a week ago.
Yeah, that's about what I did too.
And
Yeah.
I got 124 this time and 123 last time.
There you go. Nice.
So-
Yeah.
Well, I did it in September and then in October
Yeah,
last year.
Both times.
I passed the first time, the second time I did it.
When did you take your actual exam?
November of last year.
So you took the pre-exam,
Yeah,
And
and
then you
in
did
September and October.
you did the national exam, and then you did the
I did,
Oh, you
no.
said you did those both. Oh yeah,
I
two
did
days
these
apart.
first,
Okay.
and then I did my post
Yeah.
October 6th, and I did my national exam November 7th.
So have you done the final exam online?
Yeah.
Is that the? Say, I haven't done that. I haven't looked at that.
Oh, wait,
yet
what
either.
do you mean?
What, yeah,
Online?
because there's another one you could take, a final. I don't know what that one is either.
No, I went to in person to do the national.
Yeah.
I didn't do it online.
No, I'm just saying there's a final exam online. I
On
haven't
the
done
under the
yet.
practice, there is. Yeah.
I haven't
There's a
done it.
final, that's the mock exam you're gonna sit for.
Oh, yeah, so to say, I didn't do that one yet.
I didn't dare click on it because I didn't want to start some timer if I wasn't ready to do it.
Oh, yeah, no, I didn't do that.
Yeah, when I did it a week and a half ago, it kept on freezing on me. I ended up I made dinner and had dinner, and I came back and it in the last like 45 minutes,
Right.
like an hour and a half later.
Was your computer doing something? Like
No.
updates or something?
Okay,
No, it's just
can you see this on?
Yep, we can. It's good.
Okay.
Yep.
All right, so here's the question. We're in medicine. A 64-year-old male, you want to write this down, 64-year-old male comes in for his flu and pneumonia vaccines. The flu is a trivalent split virus, and the pneumonia is 23 valent.
Okay, the flu is what?
The flu is trivalent split virus.
Trivalent split virus.
Yep. And then the pneumonia is 23 valent. Code only the immunization administration and diagnosis for the vaccines.
Okay, pneumonia was 23 valent.
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 Pneumonia 23 valent. VALENT. So 64-year-old male comes in for his flu and trivalent split virus and pneumonia 23 valent vaccine. Code only the immunization administration and diagnosis code for the vaccines. So
Immunization,
admin and diagnosis,
admin, and diagnosis for
the vaccines.
vaccine.
So what do you think you can get rid of right away? If you know your Z codes, what do you think you can get rid of right away?
Z28.
The first two.
Why?
28. Yeah.
Because it's not for encounter of.
Those can go. Yep.
Okay?
Yeah.
Now go to it. Find your answer. You're on the clock.
Oh.
Time. Darcy, what do you have?
I have 90471, 90472, 90658, 90732, and Z23.
Fran.
Got 90471, 90472, Z23.
Jenna.
I went with C as well.
Shanna.
I did see.
I did the one with the 3 codes, 471, 472, and Z23.
Anita.
Yeah, the three.
Okay.
904712 and C3.
Okay. So the answer is C. And the reason being that you're going to code the first administration, which is the 471, then the second administration, which is the 472, and then the encounter for the vaccinations. Okay? So you would not code all of those others because if you have directions in your ICD-10 book, it says to only code the administration and the diagnosis codes. There's directions in the exercise was only to code the administration and the diagnosis. Does that help, Darcy?
Yeah, I just looked too far into it. Just read
Yeah.
into it too much.
That's honestly what we do, which is why I said earlier to you, Amber, don't overthink it. All right, let's do a couple more. See what we can do here. We did that one. I like this one. Okay, so this is the exercise. This is the question. Katie is back for a 2-year follow-up comprehensive ophthalmologic exam. 2 years old, 2-year follow-up comprehensive ophthalmologic exam. The physician provides a gas permeable extended wear contact lens for the right eye. She is to follow up in 1 week to see how her contact is working. Code the exam and the supply for contact lens. What's the first one we can get rid of?
The second one.
Second one, yeah.
Okay? Go ahead, you're on the clock. Code for the exam and the supply of the contact lens. It's a comprehensive ophthalmological exam. So you know it's any one of these three. So really all you need to code is the diagnosis. So you need to find out what's your diagnosis. So which one of these reports the supply?
I'm reading the word motorcycle and I just heard that. I was like, what? So this is, I'm confused. I'll get this one about.
Okay.
When I took it on the exam, the V codes were from the HICPIC book. And I didn't know that because I didn't recognize them.
The
So I
V
didn't-
code shouldn't be from the HICPIC book.
It was though. And it
'Cause-
made sense once I found them in here. So,
That doesn't make sense.
because this, I don't know what. And that's why I didn't know why.
So you're saying like this.
Correct.
Okay?
That's the way it was on the exam.
Okay, then look it up that way.
Because I didn't even know where those codes came from until afterwards I looked under the HICPIC book. But that's the section that talks about the
Because it's the supply of contact lenses.
Right.
Supply codes come from your HICPIC book.
Okay.
See, I didn't know that.
Yeah, see, I just associate the HICPIC with main care or Medicare. So I guess when I don't see that in a question, I don't
Yeah,
know
and
when to go to the HICPIC book.
Right.
I don't know when to use
Neither
that.
do
any
I.
type of
I
supply.
just don't. A supply.
A
Okay.
supply.
Yeah, because 2513 is contact lens gas permeable extended wear.
See,
Time.
So
I didn't even.
because I looked at it like this. Yeah.
Oh, well.
Okay, so Fran, what'd you get?
92014 and V2513.
Okay. What'd you get, Anita?
I think it's 92014 V2530.
Darcy?
I got 92014 and V2530.
Shanna? Jenna?
I had 13.
Amber?
I said 13.
Suzanne?
I say 30.
Okay. So I want you to look up V2513 versus V2530 and tell me what's the difference.
Because I have a different book than you do too. Whoops, I didn't mean to kick you.
Okay.
Yeah, and then I read 13 too, which is extended see contact lenses, gas permeable, extended wear. So, I don't know.
And what is V2530?
Scleros.
Gas impermeable per lens.
Per lens.
Okay, so,
I don't know. Extended, but I don't know. I went with 13 because it said extended wear, which I think is what the question
and that was
said,
what
but
the
I forgot.
question said, was extended wear.
Okay.
So it's A,
Okay.
V2513.
So they're so close, yeah.
So, Good job for being on the ball because I put the decimal
So the
in
answer
there.
is what? What was the answer again?
A.
Didn't you say gas permeable though?
Gas permeable extended wear contact lens.
So isn't that 2530?
Yeah, but look at
Gas
13.
permeable.
Right, yeah.
Contact lens, gas permeable, extended wear per lens.
This isn't extended wear.
Oh, okay. Okay, yeah, I got it now.
This one is extended wear. This one is not.
Right, okay.
All right.
On your textbook tab. First time I opened it was when I took my free test.
Wow, that's scary.
I don't really have many tests.
I don't, yeah, I'm like, I don't know how to use this book at all.
Book was pretty
It is really, yeah.
All right. Yeah, the big thing about the HCPCS book is you just want to pay attention to the G codes for the screenings, the colorectal screenings for the Medicare patients,
Right.
and some of the immunizations that they receive. But you also want to tab the modifier section because I can tell you that there are modifiers in the HCPCS book that you will not find in your CPT book.
Right.
Yep, I have mine on.
That was one of
Like
the
your
SEA questions.
QX
Yes, that was the one I got
and
wrong.
AA and AS
Mm-hmm.
and QK.
Yeah, that was the one I got wrong.
QK.
The
Oh,
AA, I remember. There's just a couple that I agree.
Could you repeat that again? It's QK,
QX,
QX.
AA, and AS. Also pay attention to
That's in HCPCS.
lost my thought, sorry.
Modifiers.
All right, we'll do one more and then we'll close it up.
Okay.
All right, here's the question. The patient is taken to the operating room for the insertion of a Swan-Ganz catheter. Patient is taken to the operating room for a Swan-Ganz catheter. The physician inserts the catheter for monitoring cardiac output measurements and blood gases. The patient is taken to the operating room for the insertion of a Swan-Ganz catheter. The physician inserts the catheter for monitoring cardiac output measurements and blood gases. Go ahead. And this is where guidelines come in. Time. All right, so what codes do you think we can get rid of right off the bat? Amber?
The 454, I eliminated first.
How come?
Catheter placement in coronary artery.
Okay. What about these 36 codes? Jenna?
I chose not to use them because 93503 specifically says Swan-Ganz catheter placement, so.
Okay. So, if you go to the front section of your CPT, is there a line item in there that says something about the guidelines for Swan-Ganz catheter?
You mean like the medicine section?
Yeah. Or this section where you found the 93503. So somewhere in here, we should have something that says Swan-Ganz catheter. Let me see. 93503.
Placement of a flow-directed catheter.
Yep, it's at the bottom of page 613 in the CPT.
Thank you, Fran. I knew you'd have my back.
You're welcome.
Okay, so page 613 in your CPT book, bottom left-hand column, Swan-Ganz catheter.
Yep.
And then it goes up over to the right-hand column. That would definitely be a section that I would highlight. Because whenever you know you have a Swan-Ganz catheter, you're going to use the Swan-Ganz catheter code. Because you're not supposed to use it when you're doing cardiac catheterization. Okay? All right, let's see if there's one more. All right. How does everyone feel after that?
Good.
Darcy?
Good.
Any help?
Oh, yeah.
Yeah, a lot of help.
Very good.
Okay. Amber?
Yeah, I mean, overall I felt pretty comfortable.
Okay. Suzanne?
I'm confused.
More confused than before you got here?
No. Just about this one.
This particular one?
Yeah.
What's the question?
Well, I'm not sure about the code, how to get this code.
Did you look up Swan-Ganz catheter?
Yes, I did.
And what did it bring you to?
Well, okay, it was, oh, there it is, okay. 93503, okay, because I didn't have time to look it up.
Okay. Okay. So you can do it one of two ways, as we talked about earlier. The first few times, if you have duplication of codes, you can start from the front or you can start from the back. If you've got a good memory, and I'm not talking about memorization. My husband can't stand it because I can pull out numbers that he forgot, years ago. or I can see a number and remember where I saw it, or remember a number and someone asked me a question. For instance, today, one of the doctors asked me, how much is this divided by this? And I had already figured it out earlier myself because I wanted to know, and I just answered her. And she's like, what? You have a good head for math. I said, no, I already figured it out earlier this morning.
You should have told her that.
But it's that memory, it's that memory. It's not memorization, it's you have that.
Realizing.
Right. So, but also knowing how to utilize your guidelines, okay? So trying to steer you tonight into the direction of those guidelines, like the Z23, the Swan-Ganz catheter, okay? Those types of things, the V20 for AIDS, okay? Really read and look at those guidelines. Those are the things that are going to stick out and come up for the ICD-10 or the national exam, whether it was 9 or 10. You want to pay attention to those things. So besides time management, it's knowing where to look in those guidelines. Pain, as I said, is another big one. Make sure you have that pain section at least tabbed so you can go to it. Anything like that. For those who are moving from ICD-9 to ICD-10, just please stay in touch with me so that we can work, moving forward, making sure that you're testing or doing the exercises if you need stuff like that, okay?
Right, okay.
Because if you can, call tonight. Okay. Any other questions?
So you've been using the 9 for years.
And then I had to go to
So
10.
how was it for you to go into 10?
Actually, not too bad. And I had to take the ICD-10 proficiency exam, which I thought was funny. But it was good. But I didn't have to sit for 5 hours and 40 minutes.
Right.
So I definitely see where ICD-10 it can be easier and much easier because of the level of specificity.
Yes.
And again, you use these numbers so often that you just kind of, remember.
Right. Yeah.
Okay? Or like the one that had, 5 or 6 codes. And the exercise said only code the immunization, administration, and diagnosis. So right there it's only 2 codes.
Right.
Or that these were wrong because they're 3s.
Right.
And we're in the medicine section. Remembering those things, because if you're in a certain block and they're throwing in a code that doesn't go in that block, that's another thing to remember on the test.
Right.
I was feeling like it could be a trick.
I know. But I told you all along in class, if you're under cardiology, you're going to answer with cardiology.
Right.
If you're under musculoskeletal, you're going to answer musculoskeletal. Path and lab.
Right.
Anatomy.
Yep.
Okay? Those are the things to pay attention to. All right, so for those of you who have already sat for the exam, you have only up to a year to retake it. Again, work with me. I'll help you get that far again. And if you have questions, you know how to reach me by email, right? And thank you very much for your time tonight. I appreciate it. I hope it was helpful.
Yes.
Great. Any last minute?
I don't think so.
Okay.
Guess we'll see you in a few weeks.
All right. See you in a few weeks. Thank you.
Thank you.
Thank you.